Student health contributes to student academic success. This slide presentation is brought to you by the HealthSmart Virginia website based on a National Association for State Boards of Education Policy Update, Volume 22, Number 11. A large body of evidence ties health to academic achievement. As such, the investment of school systems in student health is wise and imperative. Safe and healthy environments, adequate health and mental health services, provision of health literacy skills, and a curriculum that inspires and equips students to pursue healthy lifestyles and contribute to healthy communities are all ways that schools can do this. Decades of evidence connect health and learning. In a special issue of the Journal of School Health, several articles highlighted the important connections between health and learning. One article in particular summarized decades of research that connect health and academic achievement across the 10 dimensions of the whole school, whole community, and whole child model shown here to the right. Making the connections between health and academics, physical education, and physical activity. Increases in participation in PE classes and classroom physical activity breaks are associated with better grades, standardized test scores, cognitive performance, and classroom behavior. Time spent in recess encourages pro-social behaviors and is positively associated with cognitive performance and positive classroom behaviors. Furthermore, participation in extracurricular physical activities is also connected to higher grade point average, lower dropout rates, and fewer disciplinary problems. We know that programs that include a health education component increase academic grades and test scores, decrease school absences, improve student behavior, and reduce school dropout. Health education also allows students to learn and practice communication and social skills that enable them to resist social pressures, which can in turn reduce risks for unintended pregnancy, smoking, alcohol, and other drug use, all of which impede academic achievement. Making the connections between health and academics. Nutrition. Student participation in school breakfast programs is associated with better grades and standardized test scores, reduced absenteeism, and improved cognitive function. Students who skip breakfast experience decreased cognitive performance. We know that school health services help students manage chronic conditions such as asthma, poor vision, obesity, and poor oral health, and reduce absenteeism and improve academic outcomes. Schools with smaller school nurse to student ratios are associated with lower absenteeism rates and higher graduation rates. Making the connections between health and academics. Counseling, psychological, and social services. School-based mental health services and universal mental health promotion programs benefit attendance, student behavior, test scores, and may decrease suspension rates. Support for staff wellness through policies and programs improves teachers' productivity and classroom effectiveness and reduces absenteeism. All of these outcomes can have influence on students' learning. School staff are also powerful role models and can help engage students in healthy behaviors. Making the connections between health and academics. Social and emotional school climate. Students' belief that adults and peers in their schools care about their learning and about them as individuals is associated with school attendance, staying in school longer, and higher grades and classroom test scores. This connectedness has also been shown to be a strong protective factor in reducing unintentional injury and risky behaviors such as substance use, early sexual initiation, and violence. Furthermore, increasing the safety and security of school grounds and improving indoor air quality problems, including allergen reduction, for example, can reduce injuries, illnesses, and absences. We know that students in elementary, middle, and high school whose parents are engaged in their school lives are more likely to attend school regularly, earn higher grades and test scores, graduate, and have good skills in classroom behavior. Students with engaged parents are also less likely to smoke cigarettes, drink alcohol, become pregnant, be physically inactive, and be emotionally distressed. In schools that include community involvement through volunteers, additional services, and shared resources, improvements are seen in student attendance and behavior and improved grades and test scores. The Virginia Health and PE curriculum standards drive academic achievement. In the preface to Virginia's standards, it says students will learn essential health concepts, develop understanding of health information, and actively advocate for their own health as well as the health of their peers, families, and communities. The standards follow the research-based recommendations of the Centers for Disease Control and Prevention for health education curricula by teaching functional health information, shaping personal values and beliefs that support healthy behaviors, shaping group norms that value a healthy lifestyle, and developing the essential health skills necessary to adopt, practice, and maintain health enhancing behaviors and academic achievement. Please visit the Health Smart Virginia website located at www.healthsmartva.org to access instructional resources aligned with Virginia's health and PE standards of learning.